My name is Chris Carrasco. This is going to be a video talking about and demonstrating CPR on a veterinary patient. And so CPR, the term for that is cardiopulmonary resuscitation, and that is going to be it's something that you would perform if you had a patient that underwent either cardiac or respiratory arrest. So the tools that you're going to need at a minimum are going to be an endotracheal tube to insert into the patient's trachea, and some form of oxygen, either a ambu bag if you don't have an anesthesia or oxygen circuit or oxygen tank that's readily available, or an anesthesia machine that's connected either to a main oxygen line or to an oxygen tank. So the proper amounts of compressions per minute are going to be between 100 and 120. There's a few different techniques that people use. The most popular one is the Staying Alive song, which is taken from human healthcare workers that perform CPR. You can also use different songs like Baby Shark. It's become more popular now, things like that. But the ideal is about 100 to 120 compressions per minute. And then you're also going to want to be giving your patient 10 breaths per minute while they are intubated. And that is either going to be, you're going to be paying attention to the manometer that is on your ambu bag. Most of them have them now, or that is on your anesthesia circuit. And you want to be between 10 and 20 centimeters of water. 10 would be probably for a smaller patient like a cat or a toy breed dog. 20 would be for a regular sized canine patient, and you want to keep that at about 10 breaths per minute, so you don't hyperventilate them, and give their lungs a chance to expand and to be able to get oxygen to all of their tissue. The main drugs that you're going to use for any CPR, the main ones are going to be atropine and epinephrine. Other drugs are going to be, like lidocaine, sodium bicarbonate, calcium gluconate, things like that. But the most common ones that you're going to reach for are going to be atropine and epinephrine. Atropine is an anticholinergic, and so that is going to block the parasympathetic tone and decrease bradycardia, thus increasing the heart rate. And epinephrine is an adrenergic agonist, and that is going to basically cause peripheral contraction and increase the heart rate, which are both critical things in a CPR setting. And the easiest way to remember these, there are charts that are everywhere. Our hospital has them in all of our treatment areas, and especially in our ER and ICU. Next to the crash cart, but I kind of have memorized them working in an emergency and critical care setting, and the way that I remember it is that atropine is going to be 1 milliliter per 10 kilograms of body weight, and then epinephrine is 10% of that. So for example, if you have a 10 kilogram dog that gets rushed back to the treatment area, the dog has arrested and the owners have said that they want to try and resuscitate them. First thing that you're going to do is start chest compression. Somebody is going to be intubating the patient, and once you have venous access, that patient is going to get 1 milliliter of atropine and 0.1 of epinephrine, and then adjusted from there, obviously, going on a rough body weight. If you can't get venous access in your patient, you can give these drugs through an endotracheal tube. It's not ideal because we're not sure how well they're absorbed that way, but if you absolutely can't get venous access, they can be given through an endotracheal tube until you can get venous access. and you just have to double the amount that you're giving. So for a 10 kilogram patient, you would give 2 mils of atropine, double the amount of epinephrine, etc. Other drugs that are going to be in your crash cart, like I said, are going to be, depending on where you work, we have drugs like atipamezole, naloxone, flumazenil, and like I said, calcium gluconate and things like that. If you are working in a general practice, more than likely you may not have all of those, but at least atropine and epinephrine are going to be the most important ones. And then kind of the last thing to talk about before demonstrating CPR is going to be what you would do in the event that your patient goes under cardiac arrest while it's under general anesthesia. This is a little bit different than a patient that has undergone trauma or a hospitalized patient that has arrested because of their disease process or comorbidities. Most anesthetic-related cardiac arrests are due to drug reactions. And so the first thing that you would do in the event of a cardiac arrest under anesthesia is alert the veterinarian that the patient's heart is no longer beating. Immediately turn off your vaporizer and flush out, disconnect your patient and flush out the circuit with the flush valve to flush all of the gas out of your circuit, and immediately reattach them, and that way your patient is just on 100% oxygen. And start chest compressions, and immediately after starting chest compressions, the next thing that you're going to want to do is reverse any drugs that have been given. So for example, if your patient got dexmedetomidine as a pre-med or while it was anesthetized, you're going to want to give atipamezole. If it's had any opioids, you're going to want to give naloxone. And if it's had any benzodiazepines, if you have flumazenil in your hospital, you can give that as well. Reverse anything that can be reversed, and see if you are getting heart rate back. If not, then start giving your emergency drugs like your epi and your atropine. And so this is going to just be an example of how to perform chest compressions on a patient. On a medium-sized dog, or medium to large-sized dog patient like this one, you would have them on their side with their back facing you. I like to put my hands kind of over each other, just right over their chest, right where their heart is going to be. In smaller breeds like cats and toy breed dogs, you're going to want to use what is called the thoracic pump technique. So basically one hand is just going to go over their chest, and you're just going to pump the heart just like if you were doing chest compressions. And then the last one is going to be like brachycephalics, like bulldogs and things that have really stocky chests. You're going to basically want to put them on their back like a human, and are going to put hands right over where their heart is sitting and just pump like that. And so last is to demonstrate how you would do chest compressions. I'm not really going to talk during this because it's important to remember to breathe, and a lot of people don't. I like to have a stool or something available to be able to get over your patient. That way you can be over them and keep your elbows locked and be able to get the most out of your compressions. If you can't do that, if you don't have a stool available, I've also jumped up on the table before. Or last resort is that if you are not able to get to a good height, it's a larger patient, you can just put them down on the floor. It's not ideal, but if that is the best way that you can get your compressions, then that's kind of what you have to do. All right, and so And so that was only a brief demonstration of about 30 seconds of chest compressions. Ideally, you want to not have any stop in compressions. The only time the compressions should stop is if that you are doing a rhythm check, basically to see if your patient has gotten a heart rate back. Otherwise, there should never be a stop in compressions. And so communication is the biggest thing when you have a group of people that are in a CPR setting. And so usually I try to do for 2 minutes at a time, and just letting somebody know when you're getting tired that you're going to need to switch. And basically that way that person can come right behind you and basically just put their hands right over yours, and you move away and they immediately start compression so you never stop. And that's it.